At the start of COVID-19 pandemic, several private hospitals were turning away patients because they do not have the facilities to carry out this testing. The risk to the staff is very high, coupled with the fact that the hospital wants to avoid crowds of people in their facility.
And who can blame them? With recent developments in Nigeria, more private laboratories are beginning to show interest in getting involved in COVID-19 testing.
Well, joining us now to discuss private laboratory testing capability of COVID-19 in Nigeria is Dr. Olayemi Dawodu, an anatomical pathologist and managing director, chief executive officer of Clina-lancet Laboratories. Thank you so much for finally joining us, Dr. Dawodu. Great to have you on the show this morning.
Good morning. It's good to be on the show. Thank you.
Yes. So a lot of attention has been placed on testing. But as the cases spread globally, there are increased numbers of suspected cases. But countries are not meeting up with that testing capabilities, which we talk about, especially here in Nigeria with our population. In a country like South Africa, their success story of being able to carry out the number of tests they've done is accredited to the involvement of the private labs in the country. Why are we not seeing such scaled contributions from private sector labs such as yours? What do you think is responsible?
Opinion about that is authorities are probably trying to go through some diligence and requirements that set out to onboard private laboratories such as ours. Now, in doing so, there have been a few pathology labs in the private sector have capability to carry out testing for molecular testing. For molecular testing, I think what it is probably in fighting the pandemic in the public sector, they are also trying to work on assessing all those in the sector to onboard them. I can tell you that our organization as well has also put up all the has also filled out the requirements that were put out by the authorities responsible for accrediting private labs. In saying that, there's also been issues with I'll be honest with you, in terms of the availability of reagents, even their platforms that are available. There are issues with reagents to carry out this test, even in the public sector.
Right. I just wanted to further a little bit on that, to talk about ramping up testing. I mean, when you look at the bulk of work South Africa did with ramping up testing, there's a major involvement with private labs in South Africa. Is there any symbiotic relationship with the government as regards testing? And because most of these tests go at no cost to the citizenry, is there any sort of like a subsidized or mechanism or palliative for this test when you guys are called in to do this? Can you talk to me about that?
So it's interesting now to address that. That a month ago, there was a document released by the CDC, where one of the prongs of the framework was to incorporate the services of private pathology laboratories or Clina-lancet. And that was updated yesterday, as a matter of fact. The last 24 hours now brought out an augmented document that states that we are ready to engage the private pathology laboratories across the country. In doing so, they put the value proposition at cost in testing. So they've said they will share testing. They've also spoken about helping with paying of personnel as well in onboarding the private sector. Basically, I honestly will not be able to tell you it has been this slow and it has taken so long to incorporate the private sector in testing, because obviously, to be honest, we're not testing enough. As at Monday, we had done about 27,087 tests across the country since we started testing. That is a very, very low amount of testing. If you're looking at Lagos State, that's 1% of the population of Lagos, talk less of the entire country, are in 0.00% of tests. So I agree with you that there's not a lot of testing. I might not fully answer in regards of why the authorities are taking this to incorporate qualified clinical pathology laboratories, because we do have them across the country who are already poised to test. My organization has always had molecular testing platform.
All right. Well, actually, a very big thank you to you, Dr. Dawodu. But that's the way it works with technology sometimes.